Hi everyone, we're back, and this is part 3 of the new nurse over morning coffee. Well, here are two nurses having coffee, and this is their conversation. How do you like being new to ICU? I really enjoyed. I got to watch a pulmonary artery catheter inserted on a patient with an MI and Cardioversion on another. Why would she be watching all this? Well, Tim and Jenna are both new nurses. They both started out on the surgical floor, but Jenna transferred to the ICU about 2 weeks ago. Jenna is excited to share what she has learned. However, she has been neglecting her responsibilities. Yesterday, she did not do documentation for hours and did not give medications that were due. She was too busy watching procedures so she could brag to her friends. Now, this is not a wise idea. I know when you first transfer to a different area, it's nice to talk about what you see, but as a new nurse, there's plenty of time to catch up. There are certain responsibilities. I've had students I've precepted who've done this kind of thing. They were so excited to be in ICU that instead of doing what they were meant to do, they rush off to watch procedures and neglect their own responsibilities. Not a wise idea. Well, let's talk about what is a cardioversion. Well, typically cardioversion is done for a patient who is in atrial fibrillation. The goal is to take that patient from that rhythm back to a normal rhythm. And you can go to Dear Nurses, or you can just watch the videos on EKG reading sessions 16, 17, and 18 at dearnurses.com, and that will enlighten you more. Defibrillation should not be confused with cardioversion. Defibrillation is usually done as an emergency to shock a patient's heart back to life so you can get blood flow. Cardioversion, however, that patient is not in cardiac arrest like the patient who's being defibrillated. That patient has a rhythm like an atrial fibrillation or flutter, and definitively it needs to be treated, and it is not done as an emergency. Typically what happens, the doctor shocks the patient on the R wave of the EKG, as this is used as a landmark for converting the heart back to its normal rhythm. I've seen it work, I've seen it not work. I've seen it work and then the patient goes back. There are other variables. They give them beta blockers. It's a process. It's difficult to explain it all. You have to witness it and follow the progress of that patient. ACLS guidelines usually takes care of all that. Now, how would they even have that patient in cardiogenic shock who had that PA catheter? Well, let's give an example of a myocardial infarction. Here is this man, Joe. He's getting dressed for work when he suddenly starts having really sharp pains in his chest. 10 of 10, 10 on a scale of 10. That's how bad his pain was. His wife comes to help him. He's having a myocardial infarction. In his case, he was taken to the emergency room. He was diagnosed with an anterior wall myocardial infarction. If you'd like to learn more about this topic, go to dearnurses.net and look in what is it, and you'll find plenty of helpful information on this topic. Now, cardiogenic shock can happen to the patient who's had an anterior wall myocardial infarction. In fact, it's one of the worst. Years ago, it used to be called the widowmaker because many men did not make it and their wives were left as widows. Here is a clinical picture of a patient in cardiogenic shock. What would you expect to find? Well, like I said, it is due to a myocardial infarction. The left anterior descending coronary artery has obviously been blocked, and you have substantial damage to the muscle of the left ventricle. Unfortunately, the left ventricle is where you get your pumping power, and you could very readily wind up with far more serious problems like cardiogenic shock, left ventricular failure. It's very difficult. And these patients may wind up on a ventilator in the ICU. Hypotension may ensue, low urinary output because there's not a lot of blood flow. The heart cannot pump effectively. Fluid backs up into the lungs. It's quite a complex situation. Remember, the heart is a pump, and it pumps blood around the body. Once it's been damaged, it can no longer do its full work. So that left ventricle, where all that pumping power is now affected, and blood just backs up. There's a lot you can learn. The skin is cool and clammy, and it's a process. Anyway, you can go to dearnurses.net and you'll find a lot of helpful information on, and dearnurses.com also. There is a case study on the patient in congestive heart failure, which all follows the same sort of pattern. Now I wanted to talk about also the patient, what exactly is a pulmonary artery catheter? Well, a pulmonary artery catheter, P8, used to be known as the Swan-Ganz line. And what it is, it's a line that's inserted into the heart. If you've ever had the opportunity to see it, it's actually quite interesting. It's done as a sterile procedure, and as it's done on the doctor, that balloon-tip catheter is inserted into the heart. On the screen as it's going in, you can see when it goes through all the different chambers of the heart. There is one pattern definitively, as you can see here, for the right atrium, which is called the central venous pressure. Another one that goes into the right ventricle. Finally, it winds up into the pulmonary artery, and it's left in there to float. And then there's something called the PCWP, which is wedging, and that's when they read the pressures. And this is used as a diagnostic tool. It's very interesting, and it's very, very informative. It's a very useful diagnostic tool, and it's used for conditions such as cardiogenic shock, myocardial infarction, a septic event, trauma, pulmonary hypertension. So I hope you've learned, and take the time to go to either dearnurses.org or .net or .com and enjoy learning. Have a great day.